NTV.
Elsewhere, church leaders want the government to temporarily suspend the ongoing rollout of the Social Health Insurance Fund, SHIF, following complaints by patients that they now pay out of pocket for services that were fully covered under the previous Health Insurance Fund, NHIF. Calls for a review of the SHIF rollout have been continuously dismissed by Ministry of Health officials who claim that the new National Health Insurance model is functioning. As NTV's health and science reporter Brendan Ngana now explains.
Hii sasa ya Taifa Care tukisonga mbele, mpango yetu ni kwamba iko na pesa ya kutosha kuhakikisha ya kwamba kila mwananchi ambaye anaenda kutafuta matibabu, tutahakikisha kwamba wanapata matibabu bila ya ubaguzi, na hakuna mwananchi tena tukienda mbele ambaye ataulizwa mambo ya pesa katika mahospitali yetu.
President William Ruto for the umpteenth time making the assurance that SHA and SHIF are working.
We give all that.
But church leaders through the National Council of Churches of Kenya, NCCK, who preside over medical facilities run by faith-based organizations, have delivered their prognosis a month since the new health insurance model SHIF was rolled out.
Let us not sacrifice any more lives just to get money out of Kenyans. Let us do this, and then we can go back to SHA when all is worked out and life and everybody is stable to move.
NCCK says that SHA and SHIF were hurriedly rolled out, and the evidence is in the numerous reports of patients paying for services in cash despite being registered under SHA.
It does not make sense to us that Kenyans are now paying more money but are getting less benefit. We are moving from okay to worse.
We have members who are on dialysis. We have members who are diabetic. And to our surprise is that when they get to the hospitals, they don't get the services they require. And in most cases, they are forced to get into their pockets.
Speaking in one accord with NCCK is Nyeri Diocese Archbishop Anthony Muheria, who says what's happening with SHIF contradicts every aspect of upholding human rights.
Our leaders are thinking way too much about their image and about their future, and not thinking about the image of the poor, the needy, the miserable, the ones living in slums, the sick. With the shift of the NHIF to SHIF, we don't seem to have had that thought of the sick. People who die because they can't get services. That's our main concern.
The government is promising us that the whole process of SHIF is in full operation. Then we tend to ask ourselves, where is it operating? If the common man is not fully attended according to his or her needs, how can we convince our members that the SHIF is working?
But the Cabinet Secretary for Health, Deborah Barasa, while presiding over the graduation of specialized nurses at the Kenyatta University Teaching and Referral Hospital, says those finding fault with SHA and SHIF are misinformed.
Regarding the stranded patients, we are requesting that they can reach out through the call center to the Social Health Authority, and each individual case will be addressed accordingly. But we are working on policies to ensure that there is accessible care even to that level, because that was part of the benefit package.
Prior to the SHIF rollout, NHIF owed over 10 billion shillings to faith-based health organizations in claims. By Friday, the Ministry of Health reported that 14 million Kenyans have so far been registered under the Social Health Authority. Brendan Ngana, NTV.